my patient here had an upper eyelid blepharoplasty just over a year ago. However, she's still complaining of some excess skin. So what we're gonna do today is take out more skin. You can see how nicely she's healed from the first time. But there is enough skin here. She does have what's called brow ptosis, where her eyebrow is low, but we're not gonna do a brow lift. The brow lift would also improve a lot of this up here. So we're gonna take out as much skin as possible so that this cleans this up. I'm also gonna do a facial fat transfer to soften the under eye hollows, and we're gonna do some laser skin resurfacing on her today. So this is the typical shape that we excise of skin, ellipse of skin from the upper eyelids. So I'm gonna numb the areas right now. So these are the specialized instruments we use. For all surgeries, we have sterile instruments. So for the upper eyelids, we have some local anesthesia here. We have these calipers that measure precisely the amount of skin we're gonna take out. These are called green forceps that I use to pinch the skin to make sure I have enough skin to take out and keep the eyes closed. These are called bishop forceps that are very fine. These are the very fine sutures, 6/0 Prolene and a 6/0 fast absorbing suture. And these are the 15 blade that we use to make the incisions. This is the basic setup for the facial fat transfer. We usually harvest the fat from the lower abdomen or the thigh area. This is the cannula we use to place the local anesthesia. This is the cannula we use to take out the fat. And then these are the specialized micro cannulas we use to inject the fat. We've harvested the fat, so here's what it looks like as soon as we take it out. So now we are going to process it on these Telfa pads, and then we're going to inject it and place it into these syringes for placement. This is the fat transfer that's been processed now. It looks beautiful. We call it liquid gold. These are the micro cannulas we're going to use. So we place micro fat, so the fat is not going to be lumpy. And I'm going to focus it in the under eye, nasolabial area. You can see how nice the upper eyelids are looking as well. Here's all the skin that we took out. This is what it looks like, and now we're going to close it up. This is the skin we've taken out, and this is the closure on the upper eyelids. We're now going to place the facial fat transfer. These are the micro cannulas. You can see how nice the upper eyelids are looking. We're going to laser her afterwards. The fat is going to go in the under eye tear trough area and the nasolabial area. We're now doing the CO2 laser skin resurfacing. What that's going to help with is improve the fine lines, wrinkles, and sunspots.